Hi, now I will talk about cricopharyngeal achlasia. This cricopharyngeal achlasia is another motility disorder of esophagus, motor abnormality of esophagus. This is not so common. In this particular disorder, there is severe contraction of cricopharyngeus sphincter, cricopharyngeal muscle, which is situated here up, and because of this, patient develops stage 1 dysphagia during act of swallowing. Now, this particular disorder, cricopharyngeal achlasia or cricopharyngeal motor abnormality, is classified into two types. One is primary cricopharyngeal achlasia, in which cause is not known, and this is the exclusion diagnosis. After excluding all causes, you will label a case of cricopharyngeal achlasia as a cause of stage 1 dysphagia. Second variety of this cricopharyngeal achlasia is known as secondary cricopharyngeal achlasia. In this type of cricopharyngeal achlasia, this is usually seen in Parkinson's disease. In Parkinson's disease, apart from other motor abnormalities, patient will develop this type of dysphagia, and this is because of abnormal motility of cricopharyngeus muscle. Motility of cricopharyngeus muscle, as other muscles motility decreases, and because of this decreased motility, there is a stage 1 dysphagia in Parkinson's disease. In and after thyroid surgery, sometimes patient develops this cricopharyngeus achlasia. So it is one of the complications of thyroid surgery. In thyroiditis, autoimmune thyroiditis, Hashimoto's disease, sometimes patient develops cricopharyngeal achlasia because there is inflammation of cricopharyngeus sphincter with thyroid. Sometimes in children's, because of impacted foreign body, there is severe contraction of this particular muscle, cricopharyngeus muscle, and so this motility disorder may be because of impacted foreign body in pediatric age group. Apart from this, in diabetics and in alcoholics, because of involvement of cricopharyngeal muscle nerve supply, there may be cricopharyngeal achlasia. These patients of cricopharyngeal achlasia, how they will present in OPDs and in ward? These patients will present with severe stage 1 dysphagia. It is known as high strung dysphagia. There is severe sticking sensation during act of swallowing. These symptoms sometimes resembles globus hystericus, so it should be ruled out. This particular type of cricopharyngeus achlasia, if it is seen in association with carcinoma of pharynx or esophagus, then that particular pathology should be ruled out. Now, what investigations you will do to rule out this cricopharyngeus achlasia? In these cases, video monitoring is done, video fluoroscopic studies are done so as to know the status of cricopharyngeus muscle contraction. Apart from this, to rule out secondary causes, you will have to do upper GI endoscopy. Upper GI endoscopy is diagnostic again in these cases. So this is how you proceed for diagnosis of cricopharyngeus achlasia. In treatment, again, reassurance, anxiolytic drugs, and relaxation exercises. This is the treatment of cricopharyngeal achlasia. If there is any cause of cricopharyngeus achlasia like Hashimoto's thyroiditis or in postoperative cases, then we will have to treat that particular disorder. If it is seen in alcoholics, alcohol must be abstained. If it is because of uncontrolled diabetes, then again it should be controlled. So this is like this we will manage a case of cricopharyngeus achlasia. Thank you.